We're learning thousands are willing to put their lives on the line to potentially save months in the creation of a COVID-19 vaccine. Brooke Katz is working on this in the studio tonight. What do you find out about this?
Well, Doug, this is all part of what's known as a human challenge trial. So far, it's just hypothetical, but 16,000 people have already said they're game.
Just like the nurses and the doctors on the front line, I'm willing to take some risks myself if it means that we can move through this as a nation and as a world.
He donated a kidney last summer, and now A.B. Rohrig is ready to volunteer again, this time willing to be infected with the coronavirus to help speed up a vaccine. Unlike other vaccine trials, in a challenge trial, one group of volunteers would first be infected with a potential vaccine. A second control group would be injected with a placebo. After allowing time for the vaccine group to build immunities, all the volunteers are contaminated with the virus.
This could save months of the time required to evaluate a vaccine. The goal is to do the fastest, responsible, and scientifically valid way of evaluating the vaccine.
Mark Lipsitch, Harvard epidemiologist, is one of the scientists whose idea of using a challenge vaccine is gaining interest from the World Health Organization. Controls would be put in place for proper medical care for all volunteers. And by selecting only young, healthy adults, Lipsitch says the chances of someone dying are extremely low.
But it is not zero, and that's why this is an altruistic act to volunteer for this.
It certainly gives me pause, and I don't want to be naive or arrogant, and I don't want to hide myself from the fact that there is a serious, not at all trivial risk to me doing this.
And the notion of human challenge trial was first raised in the Journal of Infectious Disease in March. The authors argue the pandemic justifies the use of this rather risky technique. Doug?
A lot of things we never thought about, now being thought about. Brooke, thank you.